What's up, guys? Dr. Beau here. Today I'm answering your question. I have degenerative disc disease. What is it? And can I see a chiropractor? Let's dive.
How can I help you today?
Degenerative disc disease. It sounds scary, but is it? To be honest, the answer is no. And here's why, and let me explain to you why it's not as scary as many people think. I think first off, anytime people hear the word disease, they start freaking out, thinking it's something that's gonna take their life. And when we talk about this DDD, degenerative disc disease, it's not something that will take your life. All it simply means is that there is a degeneration process happening inside the spine, more particularly inside the discs. Now, if you guys don't know, this is a picture of a lumbar spine. This is the bone or the vertebrae. This is the disc, bone, and this thing out here is the nerve. The nerves are what things go down that cause things to feel, to move, to act, etc. So when we're talking about degenerative disc, I take this portion off. This is the disc, guys. It's made up of a lot of water. I think it's like 80% water. It has these little circles all around it. And the whole idea of the disc is it does two things. Number one, it provides a lot of cushion. And then number two, it helps to aid with the curvature of the spine. What degeneration means is it goes from big and fat to skinny and kind of worn out, which means that a lot of the hydration, the water inside the discs, exits out. If you've ever woke up in the morning and got in your car and had to readjust your rear view mirror, the reason is because your discs rehydrate overnight, and a person can gain up to a half an inch overnight just by the hydration of their discs. Now, why is that important? Back to our model here. So this is pretty much what we would consider a normal looking vertebrae, meaning it's nice and square. It's got a big vertebral body in it. Versus this one, I'm gonna pull up next to it. Do you see the difference? Do you see all the jaggedness on the top here? Do you kind of see how this one's like perfectly white and this one's got like a bunch of like kind of crusty, dirty parts inside of it? And no, it's not because we've used our hands a lot, which we have with this model. But what ends up happening is that big fat disc starts to narrow down very, very, very low like that. And what happens is the body, when it comes to bones, bones are actually living tissue. We always think of bones like this, like white, dead, skeleton-like tissue. It's not. It's a living tissue that's got tons of blood going through it. It's why you can break a bone and the bone will heal itself in 4 to 6 weeks. But what it's important to know is this, is that when there's degeneration happening in the discs, the bones will lay down more bone tissue, and that's why you see like these little growths here on the sides, right here, right? And that is there to help stabilize the spine. Think about it like this. Think about your foot. When we have bunions, we aren't born with bunions, but due to pressure changes, meaning our foot posture, the body will lay down bone tissue around that first metatarsal, and that produces the bunion. Now, why is this important? Why am I talking about bones and bunions when we're talking about degenerative disc? Reason being is that as this degenerates and gets smaller and flatter, we lose the cushion, which then the body lays down more bony tissue, and the muscles have to work harder to hold up and maintain the spine. So, can a person that has degenerative disc disease see a chiropractor? 100% absolutely. And yes, we see them all day long. Matter of fact, I almost think it's critical that if you have been diagnosed with degenerative disc, that you go to a chiropractor. Why? Because as things start breaking down, as the body's laying more tissue down and narrowing out, those muscles are being harder to work, and it's forcing the skeleton to work harder, and we create a lot of muscle imbalances, which cause a lot of the times where the bones will start to go out of alignment. And then if they start to go out of alignment severely, as you can see here, we press upon nerves, other muscle tissue presses upon it, and then we start getting numbness and tingling, muscle spasms, a whole bunch of stuff. Chiropractors are amazing because we can actually adjust and put the bones back into the right place. We have specialized tables that helps to flex and extend and open up the disc spaces. Remember we talked about discs are like 85 to 90% water? Well, when we do that, it's called imbication, where we actually bring water back into the disc, which can help open up this spot here and take a lot of the pressure off of the nerve and allow this thing to move more freely. So yes, absolutely, a person should be going to a chiropractor that has degenerative disc disease. Depending on how severe it is, will really let the doctor determine what type of protocol that they want to use, what type of adjusting technique that they want to use, how intensive of a treatment schedule that they want to utilize as well. If you guys have questions about degenerative disc disease, I want you to ask me down in the comments. Secondly, when your doctor talks about, oh, it looks like you have a lot of arthritis in your spine, this is what we're talking about, guys, right? So it's going from big fat to like all of these types of things. Again, a person with lots of arthritis does really, 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 really well with consistent chiropractic care. Consistent being maybe adjusted once to twice a month. I'd probably say like, when a person gets to the age of like 40 to 45, we start to see like arthritis in their spine, and those patients just thrive getting adjusted. They do so well. They're able to go out there and live their life. It's absolutely amazing. They feel great. They function great. So if you guys have questions about DDD, degenerative disc disease, please, like I said, ask me below in the comments. I hope this helped to explain a little bit more to you, especially if you're searching online trying to figure out what this is. All right, guys, I'll talk to you later.